that we affectionately probably, I don't say compete with, but yeah, we share some common customers at times, or people that we serve. And is that a little different here than it was back in Wisconsin? It's about the same as far as looking to, because what would happen in what I've heard is that, well, you know, we got some of our people who from Coffee County go to another community to that hospital because in their mind they feel that they're going to get better service. And did you experience the same thing somewhat in Wisconsin, or is that something kind of unique to Coffee County or our South Georgia area?
I don't think it's unique to Coffee County. The one thing I would say about our competitive marketplace is, again, just like in the emergency department example, we really have a pretty great market share. We are doing well in surgical procedures. We deliver lots of babies each year. So while I think there's competition to Coffee Regional Medical Center, I also think we have the confidence of the community, be it the city of Douglas or the county. And we're grateful for that. We know that that's something we have to earn. So we try very hard every day to make sure that we're offering great service and obviously keeping the community well.
Right. Well, obviously, you know, one of the things, and I'll wrap up here and we'll take a quick break, but I do think, you know, every chance we get as a community, as a hospital, to hopefully serve people and hopefully give them that satisfaction that they've been served well is critical. And I'm glad that Coffee Region has been doing that, and Mrs. Lewis is seeking to try to, you know, raise that bar up a little bit and do it much more efficiently, and that's what it's all about. And good business principles, good customer service principles in regards to that. We're going to take a break, and we're going to be right back with more Douglas on My Mind after these messages. Welcome back to more Douglas on My Mind show, and once again I have with me Mrs. Vicki Lewis, our CEO, our new CEO for Coffee Regional Medical Center, and she's already hitting the ground running, doing a fabulous job, already got her feet planted well, and we're going to get this southern drawl out of her before 6 months in so that she'll be talking like y'all, okay, us and all that. But anyway, I was asking her at the break, so we'll ask it now while we're taping, about some opportunities that you see coming to Coffee Regional. And I always say opportunities because I hate to say challenges, because as I see it, and I hope you see it as well, they're just opportunities. There's to make a difference and improve things in our, hopefully, community here. So
absolutely. One of the opportunities we have is to recruit additional primary care physicians.
Oh, wow, good.
We are looking to recruit more family practitioners and internal medicine physicians, and that will help us further serve the community. We recently added a pediatrician. Kevin Wentworth joined our staff this past summer. If you haven't met him,
Well, I don't have any babies anymore.
He's a great person and very well trained, and again joined the staff this past summer, and he and his family are
Okay, great.
becoming acclimated to the community. But we will look to other primary care physicians, again in family practice and internal medicine, and have a significant recruitment effort underway to bring those physicians to the community.
Good, good. Well, one of the things you just mentioned, bringing these people and their families, that's so critical, and I hope that you expound on that, because we want to hear from you a few minutes about what things that you see that we can hopefully expand on to help us have better quality of life for physicians and people to our community, to help us hopefully retain them here, keep them here, and hopefully thrive here as well. That's so critical. But let me talk about a question that's pretty tough right now, because we've been dealing with it at the city. I think it's something we as a state's been dealing with as well, about the dreadful Healthcare Reform Act and how it has hopefully or not, I don't know, depending on who you talk to, impacted our hospital and the elections, what has Georgia has done in relationship to Medicare reimbursement. So talk a little about that and what you've assessed. I know, bless your heart, you haven't been there for 4.5 months and gotten in the thick of our Georgia perspective here in healthcare reform, and even though people still feel that it's going to be reversed, but what my professional medical advisors are telling, I don't think that's in the cards at this time. So we're going to have to live with this, whether we appreciate it or not. So give me your perspective of healthcare reform and the impact here.
Sure. I think some of the challenges around reimbursement are here to stay. The changes in reimbursement include higher deductibles and copays, so more out-of-pocket healthcare expenses being borne by the individual patient and their family. And I think that the number of folks who are insured under a commercial plan is going to continue to decline. As you know, there are some employers who have elected not to offer insurance, health insurance to their employees, and instead ask their employees to go up onto the federal exchange. And that's been very challenging. For Coffee Regional Medical Center in particular, the rates that were paid on the federal exchange are much below Medicaid.
Wow.
Right now, we have received offers that are less than 20 cents on the dollar to provide care up on the federal exchange. So that's been a real challenge for us. Obviously, Georgia's narrowness of Medicaid is also a challenge. I think you're referring to the fact that Georgia chose not to expand Medicaid, and accept the federal expansion. And that presents a challenge, not just for Coffee Regional Medical Center, but for all hospitals in Georgia. You're probably aware that there are 4 hospitals in Georgia that have closed, and that's directly related to some of those challenges. So I think as we go forward, again, Coffee Regional Medical Center will look to partnering with our patients, and we'll look more towards wellness. So helping the community live well and improve the overall health of the community is a real opportunity. And I think the health fair that was held this last weekend, for example,
fabulous.
is just, we had almost 1,000 people who attended that. So thank you to you and other members of the community who helped to make sure that we could sponsor that and really try to promote health. As you know, we offered screenings, wellness and health screenings, to give folks an opportunity to know their blood pressure and some of their blood work, and really look to improve their health in particular areas.
One of the things, I didn't know that your history, your tenure was a nurse, started off, and my tenure starting off in local government was HR. And one of the things I used to give a perspectively analogy to talking with our employees about benefits in regards to retirement and the health insurance. I used to do the parallels. Just like your retirement, you try to hopefully be a good investor. You try to look at your long-term perspective thought about what you need to do to make sure that you have, a secure situation at the time that you retire. We don't sometimes think about our health in the same way. But if we invested much time and effort about our health as we do about our retirement, we probably could pretty much put ourselves in a better health position just as much as hopefully in a retirement position. So I always used to give the story, you definitely need to invest in your health more so than your retirement, because your health is going to hopefully be the more beneficial thing to you, because you can't spend your retirement if you're not here. So that's how it is. So you're trying to help get employees to understand that. Now moving here 4.5 months, I used to tease physicians, cardiologists a lot, that we're the cardiac capital of the country, because we like fat back, collard greens, everything fried. We'll fry Oreo if you give it to us, so intuitively that has become a culture, a mindset that we have embarked on, and obviously that's something that has now come back to haunt us in a lot of different ways. So you're right, with all these changes that are coming about, we have to be more mindful that we need to be more healthier and make our dollars work for us more, and stretch those dollars off in ways that are prevented more so than curing. So I'm glad that you're speaking that, because a lot of our citizens don't get to hear that enough coming from the CEO. Now you heard it. The CEO stated it, so glad that you stated that.
We've done something even further. We provide wellness credits to our own employees towards their health insurance if they maintain a healthy lifestyle. So be it smoking cessation or weight reduction or just healthy living in general, including exercise, we do reward them with a lower health insurance premium if they can demonstrate that they are living a healthy lifestyle, and the same for their family.
Yeah, exactly. Well, we're 1 year, always 1 year behind the hospital, so we just implemented that this year. So if you're a city employee on a health insurance, if you're doing everything you're supposed to do as far as your health, your premiums are either stay at the level they are or even go down. But if you're not doing everything, your premiums will go up. So but obviously you got to help people make better choices with their health, and sometimes you have to do those measures to help them do that. So glad that people are getting on board. I'm glad that you are still pushing that fight for us, because we deeply appreciate it. I got a question here. As a newcomer to our community, what are some things you would like, I had mentioned this earlier, to see in our community? I know you haven't been here for 4 months, but looking around, riding around, I hope if you had a chance to do that, one of the things that me and Joanne Lewis talk about all the time, we're trying to recruit these physicians here. I know you said 10 have came within the last 24 months. Hopefully some more is on board to come in. And we always look at all the other plant facilities that we have, and people don't even know this, but we have PhD chemists and other people here in our community that are coming from all different states, even some countries, to this community to live and hopefully have some quality of life. So we want to be able to offer to them things that they can appreciate, notwithstanding that we not want to preclude any of our homegrown folks, but we want to have a good mix of things for people to enjoy and have some things that will give them appreciative about what quality life we have. So what are some things that you see that might help us improve on some of that might be beneficial?
Well, I think everything that Joanne does and the city does around economic development, I think some of the opportunity for jobs growth have been essential, and frankly that's one of the reasons that we've been able to attract physicians. Is because they know that the community's growing, and some of that is because of the economic development. I think the things that Dr. Least is doing in the school district are very important too. The fact that we've got great schools and a good opportunity just to be a safe, sound community to live in is significant. I think the relationship between the hospital and the community is also very important. So the hospital can be looked to as a safety net in many respects. Again, be it the wellness things we talked about earlier, or just emergent care. As you know, the hospital also provides the EMS in the community. So I think there's just that really great partnership between the city and the county and the hospital, but also between businesses. I don't know if you're aware or not, but there are several businesses, including Southwire, in which we have a nurse and an employee health opportunity on site.
Yeah.
And I think that has helped to improve work-related injuries and just the overall health of the working folks in the Douglas community. We want to continue to expand that. So if there are other businesses